Hey, Dr. Dow here. Hopefully you're having a good day. We're going to talk about shoulders, and specifically the rotator cuff muscles. Now, you notice how I pronounce that. It's the rotator cuff muscles. It's a really mispronounced or misspoken term. A lot of people say the rotatory cup or rotor cup. No, it's the rotator cuff muscles. Cuff like a shirt. So that's number one. Number two, let's get to the actual joint itself. The joint is a ball in a socket. Okay, so basically it's kind of a ball like this in a socket, and it rotates a lot. Very similar to the hip joint. Exactly the same joint. The only difference is the shoulder is a much shallower joint, so it's not really stable as like the hip, where the shoulder has a lot more range of motion. Again, it doesn't have that stability. The hip joint, a lot stronger joint, but that's because it's a deeper socket where it actually kind of envelops that ball, if you will. So that's the difference. But now let's get to the actual muscles. So you have the four muscles, and the one is responsible for bringing the arm, if you can see it, basically toward your body. So if your arm's at 90 degrees, your elbow's at 90 degrees, it brings it toward your body. That's number one. That's your subscapularis. Not that you have to know the terms, the muscles. The other two that are responsible for bringing it away from your body, that's the teres minor and the infraspinatus. And then the fourth muscle, it's responsible, I'm going to stand for this next one, where if your arm is kind of at the side at about 30 degrees, and you can see my arm, my hand kind of tipping like this, almost like I'm tipping a glass of water onto the floor, and it kind of brings your arm up. So that is the fourth muscle that is responsible. So those are the actions of the rotator cuff muscle, and again, their job is to make sure that shoulder joint is stable and make sure that the joint moves correctly. It's when we start to have a weakness in those joints, or in the muscles, maybe with an imbalance of muscles, of the chest muscle being too strong versus the back muscle being too weak, and then all of a sudden that shoulder joint cannot keep up with that. A lot of overuse injuries where you're using the head over your head a lot, or just in general just lifting a lot, that can irritate the joint itself. So a couple other injuries that could happen besides just the overuse, or what can make an overuse injury, is bursitis. Okay, so what's bursitis? Well, it's an inflammation of the bursa. What's a bursa? A bursa is a sac of fluid that basically is very close to the joint, that lubricates that joint. So you have, a bursa by your shoulder, you have a bursa by your elbow, you have a bursa by your knee, you have a bursa by your hip. So those all are potential for actually having an inflammation to them if they start to increase in inflammation. How do they increase? Again, overuse, maybe too much lifting, that type of stuff. Another potential injury could be what's called an impingement syndrome. So that is where the tendons and the soft tissue of the shoulder are basically inflamed, and then you have the bony prominences of the joint literally pinching itself and causing that irritation and that pain in that shoulder joint. So that could be another one. And of course, the really common one is having a tear in one of those muscles, in one of those rotator cuff muscles that I mentioned, where if it's totally torn, that's basically a surgical candidate. If it's a first or a second degree tear, that could just require some strengthening, some rehabilitation, some pain control, some inflammation control. And again, we adjust shoulders too. A lot of people don't realize that chiropractors are more than neck and back doctors, but we definitely adjust shoulders as well. So that's just a little bit of a tidbit on shoulders. I want to do the shoulder separation and shoulder dislocation in a different video, because I think that's a common question, like what's the difference? But we'll get to that in a different video. Hopefully you like this one. If you do, I appreciate it. Go ahead and check out our other YouTube videos. Go ahead and check out our other Facebook videos. And we appreciate you guys listening. Thanks a lot. Bye-bye.